Support comes from Missouri Forest Products Association, committed to sustainable and sound conservation of the state's forests, which support more than 41,000 Missouri jobs, resulting in a $10 billion industry. ChooseWood.com.
Welcome to St. Louis on the Air. I'm Don Marsh. Suicide among teens and young adults is a major cause of death for that demographic. Now research is showing an alarming trend, thoughts of suicide and actual suicide among kids much younger. Joining me to talk about it, Dr. Joan Luby is the Samuel and Mayes Ludwig Professor of Child Psychiatry and the Director of the Early Emotional Development Program at Washington University School of Medicine and St. Louis Children's Hospital. Dr. Deanna Barch is professor and chair with the Department of Psychological and Brain Sciences and the Gregory B. Couch Professor of Psychiatry at Washington University. She is also the Dean of Faculty Development. Thanks so much for being with us. Nice to have you. This is a tough subject. I mentioned it the other day, as I indicated to you earlier, to some people saying we're going to be talking about this, and jaws were literally dropping because we're talking about kids as young as 5 years old having suicidal thoughts. Where is this coming from, Dr. Luby?
Well, we really don't know, and I think that's what's so alarming about it, and that's really why there's an urgent need to try to investigate where it's coming from. We have done many studies of depression in young children in the St. Louis community, and only in our most recent one did we find much higher rates of suicidal ideation than we'd ever previously seen before. And that's what prompted us to begin to ask more questions about this and try to investigate what was the source and whether these children who expressed suicidal ideation even understood what they were talking about or understood the finality of death.
Just to be sure that everyone understands, when we talk of ideation, we're talking about youngsters thinking about suicide.
Right.
Just kind of mulling it over.
Yeah.
One of the things that we're learning, Dr. Barch, is that kids understand death. They understand the concept of death. And are they understanding that now at an earlier age than might have once been the case, do you think?
Well, I don't know whether it's the case that kids in general understand it at an earlier or later age. But what has been, I think, very surprising to us is that the kids who have suicidal ideation actually seem to understand the concepts of death better than the kids who don't. Mm-hmm. And I think that wasn't what people might have predicted. They might have thought, oh, kids don't really understand. Kids are saying things about suicide because they don't really get what death means. But these kids do understand, and even better than kids who don't have those thoughts.
You would think, though, that if they understood it, they would fear it rather than embrace it somehow.
Well, I don't know that I would call it either. I wouldn't say that they're embracing it, but I think that, they are feeling sad and hopeless and, perhaps not good about themselves. And like older people who think about suicide, they may see that as sort of an only option to end the pain that they're feeling.
Yeah. Dr. Luby, the Centers for Disease Control has done a number of studies on this issue, and their conclusions and the results are really quite alarming. What have they been learning?
Well, one of the things that's most shocking that they learned is that girls between the ages of 10 to 14 had tripled their rates of suicide over the past 14 years. Previously, suicidal ideation, first of all, had much lower rates in American society, and secondly, it used to be something that was more salient in boys, and now we're seeing an equalization of this in girls to boys, and with rates tripling, over a little more than a decade, this really has to make us worry from a public health standpoint.
And what age group are they finding this in?
10 to 14.
10 to 14. Mm-hmm. Well, there's a National Institutes of Health study also indicating that nearly 1/3 of Americans between the ages of 10 and 12 screen positive for suicide, Dr. Barch.
Yes. I mean, it is a shocking rate, and it's gone up. And we have even more recent data looking at like 9 and 10-year-olds showing, similar rates that predict that. And I think that has really been going up. I think there's a lot of speculation as to what might be driving some of that. I know a lot of people have had ideas about potential relationships to social media use, concerns that use of social media might somehow either through like bullying or negative things that are happening through social media or negative self-comparisons. Kids think, oh, I'm not as cool or as good or as wonderful as these somewhat manufactured people we see on social media, whether that may be having a role in contributing to some of this increase in depression and anxiety and suicidal ideation.
Dr. Luby, how far along are you in looking at that? It would seem to me that social media would certainly be a contributing factor.
Yes, I'm very, very suspicious about social media, and there is some empirical data to suggest that it plays a role, but I think this needs to be studied much more in a much more detailed fashion. So we are embarking on a second stage of our first study where Deanna and I are following a sample of depressed children and some healthy controls who underwent a psychotherapy treatment and expressed high rates of suicidal ideation. We're now going to be bringing those kids back in. We're going to be doing very detailed assessments of their exposure to social media, lots of psychosocial exposures, interpersonal stresses, and a whole host of other things to try to look at what the sources are.
It's hard for me to really understand why a 5-year-old or a 7-year-old would be depressed. What typically would be the cause, Dr. Barch, of a young person's depression?
Well, I think there can be a number of factors. We do see that children who have high levels of depression, they may be living in poverty and, really deprived, which we know can have a big impact. There may be family conflict that's going on that the child is often very sensitive to. They may be getting bullied, so we know that that can also be a factor as well. Even as young as preschool, bullying can start to occur. So it is often many of the same things that we see contributing to adults or adolescents having suicidal ideation or depression, but it's just in a form that sort of makes sense for a preschooler or a young child.
You want to expand on that, Dr. Luby?
Yeah, well, I totally agree with what Deanna just said. I mean, the only other thing I think I would say is that, we know that depression is a disorder that's familial. It runs in families, and certain people seem to have some type of genetic vulnerability to it. And then when they encounter psychosocial stresses, it sort of tips them over and brings them into a depression. I don't know if we know that depression is occurring now in younger children and it wasn't before, or whether we're just now have developed the methods to sort of, in a developmentally appropriate way, assess for it. I think it's more likely it's the latter.
What brought you both into this study? A series of studies, actually, I guess is the best way to put it, isn't it?
Yeah, well, I think we each came into it in different ways, and I'll let Deanna tell her story. But certainly once I got together with Deanna, we really got to the bottom of a lot of things. I mean, I was interested in preschool psychopathology, from back in my psychiatry training, and I've always just been interested in young children and the developmental processes. I find myself I really enjoy being with young children because they're very open and honest and also just more treatable. And that was really how I started studying young child depression. And then I ran into Deanna, who just added a huge dimension of neuroscience to those series of studies, and I'll kind of let her talk about that.
Well, I would actually say Joan really recruited me into studying young kids. I had been really working more with adults and a little bit with adolescents, and Joan, and I think like many people, I hadn't really understood that very, very young children could be having depression. And so Joan really sort of opened my eyes to that and recruited me to being involved. And I think similar to what Joan just said, if you think about children growing up, if they start early with having depression or anxiety and differences in development, and they continue to experience that as they're going through teenagehood, it's much harder to go back as an adult and try to roll back those years of negative experiences. And if we can think instead about identifying children very young, intervening very early, and kind of tipping them back on a healthy developmental trajectory, that's going to be so much easier than trying to peel back, 10, 20, 30 years of having lived with depression and anxiety and the impacts that itself may be having on brain development and brain function.
The suicide rate amongst teens and amongst young adults is very high. It's one of the leading causes of death. Would you assume that one of the reasons for that is that this whole process got started early in the 5 to 7 to 10-year-old range, and that it just got worse as time went on.
I think that's what we're starting to learn, right? Is that these things are emerging much earlier than we previously thought. I think we didn't used to ask the questions that would let us know that these things were happening because we didn't assume that children could feel depression or could feel this kind of deep sadness or have these kinds of suicidal thoughts. So we never, in part, thought to ask, although it could also be that some of this is increasing just even if we had already been asking about it.
What can be done in the home, in the household, to identify maybe potential problems like this? Is there something parents can look for, or siblings or friends?
Well, I mean, I do think that, we really need to step back and spend a lot more time thinking about how we nurture our children emotionally. And the idea that we as parents need to be sensitive to their emotional states. We need to be open to hearing what they're going through. We need to sit with them and help them sort of manage and experience and regulate emotions. So, I mean, I think there's a lot that parents can do, although that's not to say that, this is a side effect of bad parenting. But I think, parents can play a huge preventative role in giving children certain buffers and ways to manage intense emotions.
But parents really would have to take initiative on something like this. I mean, the kids today, even at very young ages, are very much plugged into their devices and by themselves. They're not socializing the way they used to. All of this, I assume, is contributing.
Could be, yeah. And I think, historically there's been a myth that if you ask people about suicidal thoughts, that it'll somehow create suicidal thoughts, and people have been afraid to ask about it. And that is a myth, right? And it's important for us to be comfortable talking to children at all ages about their feelings, being willing to ask if they're, seeming sad or depressed, checking in whether they have those thoughts.
Dr. Luby, they say that most adults, when they're contemplating suicide, will send out signals to that effect. I mean, they'll give away things. They'll do things that are a hint. Would youngsters do the same thing, somehow give it away that they're thinking about suicide?
Well, I think there's a couple of types of manifestations that we've seen. In a subgroup of young kids, they overtly express suicidal ideation when they're in distress. So it's not subtle at all. They'll say to their parents when they're frustrated about something or unhappy, "I wish I was dead."
They should take that seriously.
Well, yes, you should take it seriously. Absolutely. But then there's other kids, I think, who probably keep those ideations to themselves. But we would probably see those kids becoming more socially withdrawn, not enjoying things they normally enjoy, not engaging.
Yeah. Have to take a break now. We'll do that and come back, and I'll invite the listening audience to get into this conversation. It's depressing in many ways, but certainly with the research that's being done, they'll find ways, I'm sure, to deal with it in an effective way. Anyway, give us a call if you'd like to be a part of the conversation. We're talking about, if you will, suicidal ideation amongst very, very young people. 382-8255 is our number. That's 382-TALK. Send us an email to talk@stlpublicradio.org, or if you'd prefer a tweet, do so at STL On Air. This is St. Louis on the Air on St. Louis Public Radio, 90.7 KWMU.
Support comes from the Missouri Forest Products Association, committed to conservation and careful management of the state's forests to make them more resilient and better habitats for wildlife. ChooseWood.com.
Now back to our conversation with Drs. Joan Luby and Deanna Barch. Well, let me come back to you, Dr. Barch. The young brain is something that I'm sure that you're working with and studying and have worked with. The young brain is still developing at 5, 7, and 9 years old and beyond, needless to say. How is this brain development working into what we're talking about?
Well, that's a great question. It could be in two ways. One, as Joan mentioned earlier, we know that depression is familial and may have genetic contributions, and it could be that some of those genetic contributions alter how the brain is developing in kids who are at risk for suicide, and that might be contributing, say, brain regions and networks that are helpful in terms of emotion regulation and helping kids be able to control their emotions. But it may also be the case that living with depression, living with, suicidal ideation, living with family conflict might also be shaping brain development in ways that kind of become a vicious circle and contribute to kids having more depression. Either one of those possibilities, again, calls for ideally early intervention that might help shift brain development back on a healthier trajectory.
And what would that intervention include, Dr. Lumi?
Well, we're just at the very beginning of trying to figure that out, but we have developed and tested an early intervention that's a parent-child interaction therapy that focuses on helping the parent to teach the child to develop more emotionally. And we've tested that in a randomized controlled trial. It appears to be very effective. And now the question is just sort of getting it out into the community more broadly, developing other interventions for those children who that doesn't work for or who that isn't sufficient for, and to really begin to focus on this, identify it, and treat it, and not ignore it.
How are you conducting this research? Are you interviewing youngsters? Is that what it involves?
It involves interviewing caregivers of youngsters, and it also involves observational measures where we look at young kids and their parents interacting. We look at young kids performing certain types of tasks, but we also have interviewed young kids about their understanding of death, not in a direct sort of face-to-face verbal exchange, but through the use of more play and cartoons and narratives. And that's how we best get information out of young kids.
How easy is it to work with youngsters in terms of doing this kind of research?
Well, I think looking at brain function and structure with young kids can be challenging. We use a couple different methods, some of which are easier than others. We use MRI scans. We also use a technique called ERPs, which is measuring electrical activity on the scalp. That's actually easier to do with younger kids. We try to make the things that we have them do fun and engaging and appropriate for kids. You can make some of the ways of measuring emotion responses and self-control kind of fun and engaging for kids. That makes them much more willing to participate.
Where do you find the kids?
In the community, we do a lot of recruitment from like pediatrician's office, schools, a lot of outreach. We have some really wonderful staff that are really good at going out into the community and alerting parents and caretakers and school counselors that there are these resources available and research for kids to participate in.
So people would identify youngsters who may fall into this category?
Right.
Okay.
Right, where they might have some concerns that the child is having depression.
Okay. Let's go to the phones. We have a number of callers, not unexpectedly, and we'll begin with Liz, who is calling from St. Louis. Liz, thanks for being with us. Go ahead. Liz, are you there?
Yes, I'm here. Can you hear me okay?
Yeah, we can. Go ahead.
Yes, I received a call recently that young kids that are on their electronic devices as young as 4 years old have been viewing YouTube videos to tell them how to actually kill themselves and have put it into a cartoon format, and was wondering if your guests have heard anything about that, and if so, if they could elaborate.
Have either of you heard of that?
I haven't heard of that, but I have to admit it doesn't really surprise me. The things that kids are exposed to with social, this is the problem, it's pretty much limitless, and not only in its content, but also in terms of the time. And I think it's those very things, in addition to just exposure to violence, that has just become out of control and rampant.
Well, the technology of today can be a blessing and a curse at the same time, can it? Any thoughts on that, Dr. Barth?
No, I agree. I haven't seen it myself, but my teenage kids have certainly told me about things that the teenagers are accessing. And it's not surprising me. Kids are really smart. Young kids are really smart, and they will go and find things that we have no idea that they have the ability to find.
Yeah, most of us who are a little bit older have difficulty finding almost anything, it seems. Let's take another call. Kathy will join us from St. Louis. Go ahead, Kathy. You're on the air. Kathy?
Hi, this is Kathy from St. Louis. My son was 10 when he started to show signs of depression, but I didn't really realize it until later. Things like, his pencil would break and he would burst into tears, and I would be, wondering why he's reacting this way. And then I talked to a friend, and they said that it could be, he had just moved here, he was depressed about that. So I just learned to kind of watch other ways, like ways he was reacting to things, because kids don't really know when they're really young, how to verbalize it.
Thanks, Kathy. Go ahead.
Well, I think this relates to what Joan was just saying about working with kids to help them develop their emotion abilities, because a lot of kids don't have words to express what they're feeling. And if we can kind of help give them some language and help them understand that it's okay to share, either with their parents or other caregivers or people in their lives that they might be able to be comfortable sharing with.
Mm-hmm. The other thing I think is important to add is, I think when it comes to emotions, there's a real fear of sort of viewing this as something that we can identify and change and need to work on developing. If you had a 10-year-old who was having trouble with his speech, you wouldn't think, well, I'll just watch this until it goes away. There's they'll grow out of it myth with mental problems, and it's really a myth. I mean, we have to pay attention to that, just like we have to pay attention to any developmental problem and intervene rapidly.
Right. Let's take another call. We'll have Dennis in Overland join us. Dennis, thanks for waiting. You're on the air.
Yeah, this is just mind-boggling. But my experience with suicide is when it does happen, it seems to be all of a sudden there'll be loads of copycats, at least at the older level, and that is very, very problematic. With younger children, I was sitting here thinking, what could you do? And I was thinking maybe you help children accomplish small goals and build coping skills for when they, so when they fail, they don't think it's the end of the world, because so much of when you're young, you think everything is so serious. And if you can help them in that way, but the biggest monster in the room really is, and we can't put it back in the bottle, is the internet and how quickly they can be exposed to things. And I appreciate the fact that the work's being done, but it's very daunting.
It is
but
indeed.
That little idea there, I don't know if that helps or what. So.
Thanks, Dennis, for the call. But thoughts to his comment?
Well, he raises one interesting observation, and that is there is something called suicide contagion. Mm-hmm. And we've certainly seen that in adolescence when, one adolescent suicides. It's a well-established phenomenon that will increase rates of suicide in that sort of micro community. The problem is we don't really know about whether that's operational with younger kids. We also don't know what the role of social media or the internet could play in that, and I think that's another very serious issue.
Yeah, but I also wanted to pick up on something else he said, which I thought was quite interesting, which is, we send our kids to school and we teach them building blocks of reading and other sorts of things, but we don't teach them building blocks about emotion recognition, emotion regulation, emotion control, which are frankly every bit as important in healthy development. And so thinking about more, public health interventions around regular training of children and educating them on how to manage their emotions could have a big impact.
Yeah. Do we have any sense of numbers with regard to kids under the age of 11, for instance, who actually do take their lives? Is there a number out there? I mean, if it's on the increase, somebody must be keeping tabs.
We have some data from a new study, a national study called the Adolescent Brain and Cognitive Development Study that I was just reviewing this morning. And we don't have very many kids there, thankfully, that have committed suicide, but we have 2% of the kids, even at age 9, who said that they have attempted to kill themselves. It's shocking.
Absolutely shocking. Jaw-dropping, as I said a little while ago. Here's an interesting question from Victoria, who emails us. As more and more of our children are being placed in daycare at earlier ages, now frequently in infancy, she adds, is there a possibility that this growth in depression is related to secure or insecure attachments to a parent or primary caregiver? That's an interesting look at
Yeah,
it.
I mean, that's a very good question, and it's been well studied. So people have really looked at the influence of daycare on child development, and the concern that sort of daycare is globally bad for children, I think is clearly not true. I mean, the problem is it's a more complicated equation than that, and it depends very much on the quality of the daycare and the ratio of the caregivers to child. And that's interesting. That's a question that's now being discussed in the news at the moment. But clearly, high quality daycare can be a very positive experience for children. So I don't think daycare blanketly can be thought of as an etiology here.
High quality daycare can be beneficial if you can afford it.
If you can afford it.
They did an entire hour on that earlier this
Yes,
morning here,
yes.
and it's getting pretty darned expensive. Yeah. Okay, I thought we had another call here, but we don't. Let's talk for a moment in the time we have remaining about the older kids and the fact that that's a leading cause of death. What do we know about that? Is it basically the same kinds of things that we're talking about with the youngsters? Depression, social media, bullying, and that sort of thing?
Yeah, I mean, I think you see a lot of the same things. You know, they're depressed, they're anxious. High school brings with it added social challenges about thinking about having to decide about careers and work and where you're going. You also have more autonomy, to go away from your parents and to do things. And, we see it's the second leading cause of death in high school. We see astounding rates of kids who thought about having a plan. I mean, 17% of kids have had a serious plan about wanting to kill themselves at some point in time. And we need to do much more in terms of intervention.
We only have a couple of minutes left. There's a caller who wants to ask about psychologists, and there's a waiting list for psychologists, apparently, he wants to ask. That's a problem. You've got to wait through one of these episodes.
Yeah.
You see that as a problem, Dr. Lugan?
Absolutely. We definitely do not have enough mental health clinicians available, particularly for children. That's a huge problem.
Right.
Yes.
Now let's try to get a little more positive about this. What's the good news? Is there any good news here that we've learned so far through your research and other research that would lead us to believe that we can find a way through all of this?
Well, I think one piece of good news is for example, the therapy that Joan has developed, has been shown to be quite effective for depression in young children. So that means, yes, we do have some treatment approaches that are effective. We need to find a way to make them more available to a wider range of people. And Joan has really been working about kind of community engaged treatment to try to bring it out to schools. But I do think we need more of a public investment in early intervention.
In 30 seconds, would you add to that, Dr. Luby?
Yeah, I agree with that. And I think the good news is now we know about this. Yeah. So now we really need to look at it, figure out the sources, and do something about it.
Well, I think a lot of people listening to this program today are going to be stunned by what they've learned about what's going on. And certainly parents are going to have to be a lot more vigilant in watching their children and what they're doing, who they're doing it with, that sort of thing. Thank you very much, Dr. Joan Luby. Great to see you again. Thanks for being with us at Washington University School of Medicine, and Deanna Barch of Washington University. This is St. Louis on the Air on St. Louis Public Radio, 90.7 KWMU.
Support comes from the Missouri Forest Products Association. Missouri produces wood pallets, railroad ties, white oak barrels, hardwood floors, and more. Details on the variety of products made in the state are at choosewood.com.